everyone, good afternoon. Welcome to PSM paper 1, which we're going to discuss. Are you all with me? Am I audible and visible? Everybody give me a thumbs up, guys, if I'm audible and visible. Give me a thumbs up. Okay, so good to see all of you in this lovely afternoon. This time we have divided our 2 sessions for PSM. I hope all of you attended the test. By any chance, if you've not been able to attend also, you can definitely go through this live session and let's get ahead in our preparation. All right, guys. So shall we begin? Everyone ready? Okay, so the first question that I gave you was a child having streptococcal throat is being advised benzathine penicillin G. Okay, which level of prevention of rheumatic fever does this intervention represent? What have you answered for this? A child having streptococcal throat is being advised benzathine penicillin G. Which level of prevention of rheumatic fever does this intervention represent? So what have you answered? All right, very good. I have got a couple of answers. Good, guys. Now, if you look over here in the question, what is it saying? He is advised benzathine penicillin G to prevent rheumatic fever. Okay, right now what happens? The person just has streptococcal infection, so the risk factor is present, but the disease that we're talking about, rheumatic fever, has not yet started. We have to prevent rheumatic fever. So when we have to do that, like risk factor is present right now, risk factor is present, but disease not started. So if we have to prevent the disease from happening, the disease not started. If we have to prevent that from happening, what is the level of prevention we are going to talk about? We're going to talk about primary prevention. That's very good. Some of you did get this question correct. So always remember, primordial prevention क्या होता है? Primordial prevention is, let me put it here for you to revise. What is primordial prevention, guys? Primordial prevention means risk factor not present. Okay, risk factor not present. So basically what do? We educate the people. Okay, primary prevention क्या होता है? Primary prevention में risk factor present but disease not started. All right, disease not started. And what is secondary prevention? Secondary prevention is when we have to make an early diagnosis and treatment. Disease has started but it's in its early stage. No complications. अभी तक कोई complications नहीं आए हैं. So what do? We apply screening, early diagnosis. Okay, early diagnosis and treatment. Early diagnosis and treatment. And of course, if I ask tertiary, what happens in tertiary level, guys? Disease has progressed to a stage of irreversibility. Okay, disease has progressed to a stage of irreversibility. The disease is irreversible now. All right, complications are present. Complications are chuke. So what is it that we are focusing over here on? Disability limitation and rehabilitation. Got it, everybody? So that was it. I hope you all understood. Okay, I'll ask you one question. Any form of health checkup, if I say a health camp, or if I say any form of health checkup, annual health checkup, all these, eye checkup, all these are which level of prevention? To make an early diagnosis, secondary level. Clear? But if I say crutches for polio, what is this? Crutches for polio. Crutches for polio is which level of prevention, guys? This is nothing but tertiary. Why? Because the damage is already done. The person is already paralyzed. So he's been given crutches to walk. So this becomes what? Tertiary level of prevention. Okay. But if we talk about vaccination, immunization, what level of prevention is immunization, guys? Right now, the disease has not happened. Like, why do we vaccinate a 9-month-old baby with measles vaccine? Because the baby is at risk of measles. Maternal antibodies have disappeared. However, the disease has not yet occurred. So, immunization is specific protection. But if I had given you BCG vaccine for treatment of bladder cancer, BCG vaccine for treatment of bladder cancer. Now what is this? This is one exception where I am saying vaccine for treatment. So this becomes what? A secondary level of prevention. Clear? Chalo. Let's go to the next question, everybody. So the next question is a numerical. I hope you were able to do this. Can anyone tell me how did you solve this question? A district has total population of 10 lakhs with under 16 populations being 30%. The prevalence of blindness is 0.8 per 1000 among under 16 population. Calculate the total number of blind among under 16 population in the district. Now there is no escape from numericals, guys. These days numericals are being asked in the exams and we have to be prepared for numericals. Okay? Now you all know what is it being asked? It is being asked total number of blind. I have given you the prevalence, okay, in the way that I have written for you is already given to you. So here what all you had to do is see total population. If you see total population, how much is the total population, guys? 10 lakhs. 10 lakhs is the total population. 30% is under 16. So how many people are under 16, guys? How many people? 30% of 10 lakhs, right? 30% of 10 lakhs. So if you do this, it comes out to be how much? If you do this, it comes out to be how much? It comes out to be 3 lakh. Okay, everybody got this step? आपको पता करना है 30% under 16 है, तो कितने हो गए? 3 lakh. Now all you had to do was how many people are blind. So you know they have written for 1000 it is 0.8. Okay, so for 1 it would have been 0.8 by 1000. So for 3 lakhs it would be how many? For 3 lakhs it would be 0.8 by 1000 into 3 lakh. Now if you solve this, everybody, if you solve this, your answer comes out to be, if you solve this, your answer comes out to be 240. All you had to do, I'll write it here, 0.8 for every 1000. So for every 3 lakh, it's going to be how many? It's going to be 240. Were you able to do this, guys? Were you able to do this? Give me a thumbs up if you were able to do this. I didn't ask you directly, I just asked you the other way around, that how many people are, you know, the total number of blind people among under 16. So you just had to figure out the total population that's under 16, which is 30% of the total 10 lakh. Then we know for every 1000 population, it is 0.8. So what about for every 3 lakh? Okay? Okay, moving to question number 3 for the day, guys. What is this question? 100% mortality है किसी disease का. Incidence and prevalence का relationship बताओ. Anyone in the class who is able to do this. 100% mortality है disease की. So all you had to tell me the relationship between incidence and prevalence. Now is there a relationship between incidence and prevalence? I hope you remember that equation. P is equal to I into D. Prevalence क्या होता है? Prevalence is the total existing cases. Prevalence is the total existing cases. Existing cases means new plus old. And what is I, everybody? Incidence. And what is D? D is the duration of the disease. Duration of disease. Now earlier I would have told you that okay, for your FMG exams you to know this one is enough, but now they're asking you conceptual questions. So you have to know the interpretation. Now it is saying that if I increases, P increases, D increases, P increases. Here the disease is 100% fatal, 100% fatal. So what happens in 100% fatality, guys, everybody? The D decreases. Now if D decreases, guys, what should happen to P? P should decrease. Yes, P should decrease. So over here, what is happening to, however, the incidence, the rate at which new cases occur is going to remain the same. Nothing is happening to the new cases. समझ रहे हो? Only thing which has decreased is D. So if D decreases, P decreases. But the rate at which new cases will occur, rate at which new cases occurs is same. But the only problem is new cases are not getting old cases, are not transferring into old cases. Why? Either they got cured very quickly or they are dying immediately. So over here, like we can see, D is less. All right, since 100% fatal, D is less. So what is happening to P? P is less than I. Anybody has a doubt on this? Everybody understood this question? You have to remember this equation. P is equal to I into D. If we have 100% fatal disease, D घट जाता है. तो अगर D घट जाता है तो obviously the prevalence decreases. But the rate at which new cases occur is definitely the same. Okay, moving to the next one, guys. Let's go to certain study designs. All right, let's figure out certain study designs, how to approach them. A person wants to study about relationship between smoking and lung cancer. So he collects data about people deceased with lung cancer from government hospitals and the number of cigarette packets sold at the same time period. Now you remember I have always taught you an approach. If you look at the main videos, we have done an approach to identify study designs. Approach to identify study designs. Usme you have to look at a couple of things. The first thing that we've done is identify the risk factor kaun hai and outcome kya hai. Okay. Then you have to look at the direction. Now direction I've told you many times could be forward looking, could be forward. Okay. Also, if you talk about the direction, it could be backwards or it could be at the same point of time. It could be at the same point of time. Now, forward is your cohort, backward is your case control, same point of time, which was written over here, same point. Now, guys, what are the two study designs that occur at the same point of time? Anybody in the comment section? What are the two study designs that occur at the same point of time? So, if you remember your lectures, we have mentioned before also, at the same point of time, cross-sectional bhi ho sakta hai, and everybody, it could be ecological also. Now, why is it here not, why, which one are you going to say is the answer over here? Look, for cross-sectional, what had we learned? The researcher is going to collect the data himself. So, it relies on what? Primary data. But if you talk about ecological study design, we're going to rely on what? Secondary data. And what was secondary data, everybody? The researcher is going to collect the data from some previously collected data. He's not going to do it himself. He's going to rely on previously collected data. So यहाँ पे आपको clearly दिख रहा था, he's taking the information from government hospitals. So government hospitals is a hint over here that we're relying on secondary data. So what is your answer over here? Ecological. It's not cross-sectional, although it was done at the same point of time, because in that we had to rely on primary data. It's not cohort because cohort is a forward-looking study. It's not experimental because we're not doing any intervention. Clear? Give me a thumbs up. यहाँ पे population होता है ecological study design में, but here the most important thing was same time period and secondary data. I hope all of you remember this image, just a little bit this thing. सबको ये image याद है guys? This was your image of ecological study design. This is actually a scatter diagram which we are going to see tomorrow and biostats. ठीक है, ये था ना? This is a scatter diagram which is representing unit of study in ecological study design as a population. Okay, that is very, very important. All right. Going to the next MCQ for the day, let's see if you were able to answer this one. The physical examination records of the entire incoming freshman class of 1953 at University of Minnesota was examined in 1977 to see if the recorded height and weight at the time of admission to university was related to their chance of developing CHD. Okay, I'm waiting for your answers. Good. More answers, please. What do you think the answer over here is? Again, guys, never be in a rush. All you need to figure out is the approach. Okay, approach, I told you, first thing that you will do it, figure out the exposure and the outcome. Look at the direction. Look at the comparison group. Is it diseased versus non-diseased? Is it risk factor versus no risk factor? Okay, look for certain buzzwords, past history, records, matching, something like that. Okay, so let's see over here. The physical records of the entire incoming freshman class of 1953 at the university. When are you examining the records, everybody? You are examining the record in 1977. Yes, that means your study has begun in 1977, all right, but you have accessed the details of which year? You have accessed the details of 1953. फॉलो अप अभी भी कर रहे हैं वरुण, वी आर डूइंग अ फॉलो अप यहाँ पे, बट जो डिटेल्स है वो कब के लेके आए हो, लाइक व्हेन हैव यू एक्सेस द डिटेल्स ऑफ, यू हैव एक्सेस द डिटेल्स ऑफ 1953. So in 1953, a couple of students who got admitted at University of Minnesota, all right, we had taken the details. Let's say we had taken weight, just an example. On the basis of weight, then we had divided them into obese and lean, all right. And now in 1977, so we are doing a follow-up, we are looking at the outcome in 1977 at the time the study begins to see how many have developed CHT, no CHT, CHT, no CHT. So what have we done? We have accessed the details by going backwards. Okay, we have used past records. So we have gone backwards, retrospective. But what have you compared everybody? The exposures, which is height and weight at the time of admission. So you've compared the exposures. So it is which type of cohort? A retrospective cohort. You are looking at the outcome in 1977, the time when the study begins. So you can still call it as a follow-up study. The only thing is, to save time, to save money, we have accessed the details by going backwards. Outcome we are looking at the present time only. देखो guys, cohort answer होने के लिए comparison group is always exposed non-exposed, exposed versus non-exposed. Ever you see the comparison group exposed versus non-exposed, it is nothing else but a cohort. And the other term for that is what, guys? Non-concurrent cohort study. Am I clear? Give me a thumbs up if you understood this question. Now just a second. Look at these two images. I wanted you to revise this. This is there in your also. But if you look at this study design, guys, यहाँ पे study यहाँ शुरू हो रही है and you're still comparing obese and lean, exposed, non-exposed. So it is a cohort, but you're moving forward with time to look at the outcome. So ये किस तरीके का cohort है, everyone? This is a prospective cohort. Right now people don't have cancer or CVD, so we can follow them up to look at cancer and CVD. Over here also study is starting at the same time, but to save money and time, we go backwards. We access details from past records. Past records is the buzzword for retrospective cohort to be the answer. ठीक है, past records से हम लोग details उठाते हैं, divide them into tire makers and clerical staff. Okay, those who are actually, again, die makers, tires makers, exposed, non-exposed. And what do we do, everyone? We look at the outcome at the time the study begins. So, हमेशा याद रखना, this is, we went backwards to get the details. So, it is retrospective, but we have compared exposed, non-exposed. So, what is this? This is a retrospective cohort or a non-concurrent cohort. Clear? But दोनों के दोनों, since it's a cohort, you will always call it as a follow-up study. You will also call it as the incidence study. Am I clear? I want thumbs up. Anyone who did not get it, please ask me. All right. Let's go to question number 6. Anybody was able to do this? I hope everybody was. A research team conducts a study to investigate the association between smoking and bladder cancer. They select a group of patients with bladder cancer and compare their smoking history. Which of the following best describes the significance of this study in this scenario? The first thing that you need to figure out, everything is a story. What type of study are we talking about? Again, guys, what have I told you? Remember the approach. What is the exposure? What is the outcome? So here, this is the risk factor, and of course, bladder cancer is the outcome. Okay? Now, look at any buzzword that you can see. We are asking about smoking history, but look at the comparison group, a group of patients with bladder cancer, and compare their smoking histories. So you have a group of patients who have cancer. Cancer is a rare thing. So any which ways, for rare diseases, we go for case control studies. This is no cancer. So what is happening over here? Cancer, no cancer. That means case control. Yes. And we are going and comparing there. They select a group of patients with bladder cancer and compare exposure. Smoker, non-smoker. We are asking about their exposure details. Smoker, non-smoker. So everyone, यहाँ पे आप कैसे proceed कर रहे हो? Effect to cause. Already the effect has occurred. Bladder cancer. We are taking information on smoking history. So this is which type of study design, everybody? Case control. So now we had to basically figure out the true statements regarding case control. It allows for determination of incidence of bladder cancer. Never. Incidence is only done by a cohort study. Here, the cases have already occurred, so there's no point of incidence. It helps to establish temporal relationship, again wrong. What is temporality? If you remember, temporality क्या होता है? Cause precedes effect. What is temporality? Cause precedes effect. पहले smoking होगी, then lung cancer will occur. Smoking leads to lung cancer. And which is the type of study design that best establishes it? Cohort. Smoking leads to lung cancer, and the best type of study design that best establishes is cohort. It can be used to follow patients? No. Follow-up is a cohort study. Case control is a backward-looking study. So, of course, it is cost-effective and efficient way to study the association between smoking and bladder cancer. Why is it cost effective? Because you're already starting with the cases. And how do you study the association, guys? What is it that you calculate? You calculate odds ratio. What is the formula for odds ratio? Anybody in the comment section? Odds ratio ka formula kaun batayega? Anyone in the comment section can tell me the formula for odds ratio, although we will be doing a numerical, but I hope you remember A, B, C, D. It's a cross product ratio. So what is it, everyone? AD upon BC, if you remember. We will be doing the numerical also, but abhi you should know this. Okay? So this is how a case control study design looks like. We start at the present time, and you have to know it's always cases and control. We proceed backwards. Effect se cause pe ja rahe ho. And you're like, we have people with us. So what is the buzzword? History, interviews. You can conduct interviews of cases and controls. In cohort, guys, the buzzword retrospective cohort में we go for past records, old data, क्योंकि वहाँ लोग नहीं है. यहाँ पे we have interviews. ठीक है? Thumbs up, everyone. All right. Let's see this one. I'm really sorry. थोड़ा सा I think I don't know if you will be able to make out this. So I'm going to read it out for you. I'm so sorry for this little bit of handwriting glitch over here, but I'm going to read it out for you, okay? 3-month-old boy is brought to the emergency department by his parents after an episode of cyanosis and muscle hypotonia that resolved after 2 minutes. Diagnostic evaluation fails to discover an exact etiology of the boy's symptoms, and the episode is classified as unexplained bruit. Risk profile of bruit in infants largely unknown. The pediatrician who saw the boy in an emergency department is trying to identify the risk factors for bruit. She is aware of several confounders, including age, family background, all of these things. So what is she doing? She is recruiting 75 infants under 1 year of age with bruit and 75 infants without bruit of the same age. She then compares the two groups with regards to feeding problems and history of URTI. So now the question is, what was the method used to eliminate confounders? Sara Ram, it's like a big story, everybody. All you had to do is look at the buzzwords. Bruit. Bruit is something rare. For rare, we should have a case control study design. And look at the comparison group. She is having infants with bruit and no bruit. So what are you comparing, guys? Diseased, non-diseased. So when you compare that, it is case control, and she's doing what? She then compares the two groups with history of feeding problems. So she's going to ask the mothers about history of feeding problems. So how are we proceeding? We are proceeding from effect to cause. Right? Upper URTI के बारे में पूछ लो. No URTI in both the groups. URTI, no URTI. So of course there was a lot of way to figure out कि ये कौन सी study design है. Case control. And I've always told you the buzzword to eliminate confounders in a case control. What is the technique that we have? Matching. Matching, however, can eliminate only the known confounders, everybody. What does matching do? It eliminates only the known confounders. Randomization can eliminate both known and unknown confounders. Restriction is also a method to eliminate confounders. Blinding can eliminate bias. Am I clear? Give me a thumbs up. Did you understand this question? I'm just trying to show you different ways how you will figure out the study design. You have to figure out the approach. Exposure देखो, outcome देखो, buzzwords देखो. Alright. Then see the comparison group. For a cohort, it's always exposed, non-exposed. For a case control, it's always diseased, non-diseased. ठीक है, सबको समझ आया? Thumbs up. Let's move ahead. Anything that you're not understood or you want me to explain again, guys, you can just note down the question number, and once we are at the end of the session, you're most welcome to ask me. Even if you ask me 10 times, I will tell you. But before you leave the class today, this concept should get into your head. How to differentiate, okay? How to identify study designs. Chalo, iska answer kya hai? Residents of 3 villages with 3 different types of water supply were asked to participate in a study to identify cholera carriers. Because several cholera deaths have occurred in the past, virtually everyone present at the time submitted to the examination. The proportion of residents in each villages were compared. Now, okay, I agree it is cross-sectional, but I am not interested in the answer. Please tell me your buzzwords. Anybody in the comment section can tell me the buzzwords. Why are you saying it is cross-sectional? आपने क्यों नहीं बोला concurrent cohort? Why didn't you say, ma'am, non-concurrent? Why didn't you say, ma'am, case control? Why is it that you're opting for cross-sectional? I want those buzzwords, guys. So you have to tell me. A very big word over here was, okay, very good, proportion. Proportion का मतलब क्या होता है? Percentage, right? Proportion is percentage, meaning prevalence, and that is done by which study design? It could be done by a cross-sectional study design. Everyone present at the time, so it is the same point of time. And also, guys, one big word over here, this and this, 3 villages. So now remember, if it would have been a case control, we don't compare 3 groups. We have one group and we divide it into diseased, non-diseased. Are you understanding? We have one group and we divide it into diseased, non-diseased. For cohort, what do? We have one group and we divide it into exposed, non-exposed. यहाँ पे क्या हो रहा है? यहाँ पे we don't compare 3 different groups. We have one group and divide it into exposed, non-exposed. Or we have one group and divided into disease, non-disease. यहाँ पे क्या हो रहा है? 3 villages with 3 different types of water supply. I have one village, village 1. I have 2, village 3. So I have 3 villages and all of them have 3 different types of water supply. The teams are going to all the 3 villages and we are going to look at the proportion of residents who were carriers. So it is being done at the same point of time. We are calculating the proportion and we are having 3 different groups. Is it clear? Everybody rightly pointed out that the researcher collects his own data. Exactly. Because the study is being done by the researcher himself. So this is a cross-sectional study design. Okay. So this was just a way so that you're able to next time make an approach. So let's just sum it up. I'm going to give you some one-liners, some buzzword, okay? Try to answer this slide, all right? Burden, load, prevalence. Which type of study design? As quick as possible. Remember, this is RR. Okay, these answers should be on your tip. So as quick as possible, put your answers. If you see the word burden, if I ask you, let's go outside in the community and calculate the burden of diabetes right now, which study design would you want me to do? If you look at the word prevalence, if you look at the word load, कौन सी study design होगी? Very good. यहाँ पे हो जाएगा cross-sectional study. Very good. Very good, guys. Let's go to the next one. Population study is nothing but unit of study is population, ecological. Incidence study is nothing but which study design helps us calculate incidence, guys? Cohort study. What is the one where you're going to see multiple exposures? Multiple exposures. So are you going to go from cause to effect or effect to cause? Cancer, no cancer. Now you can interview them about smoking habit, drinking habit, junk food, exercise, internet addiction. Multiple exposure क्या है guys? Case control. Multiple outcome, everybody, multiple exposure क्या है? Case control. What about multiple outcomes? So you have a group, you've divided them into alcohol, non-alcohol, and now you can follow them up for years and years to see as many outcomes. I can check for hypertension, diabetes, whatever I feel like. Cohort. Very good. Rare diseases. For any rare disease, why will I wait years and years for the disease to happen? The most feasible is केस कंट्रोल. रेयर एक्सपोजर गाइस, कभी भी ऑक्यूपेशनल एक्सपोजर पे क्वेश्चन आएगा. इफ यू गेट इट ऑन ऑक्यूपेशनल एक्सपोजर, रेयर एक्सपोजर इज विच वन? Cohort. Matching is the buzzword, like we gave a question right now. Case control. Cheapest study designed to evaluate exposure and outcome. Anybody? Cheapest. Association between exposure and outcome. The cheapest, which is not at all costly. That was your hint. Cheapest. So what are you going to mark over here? Case control. But if somebody asks you best study designed to evaluate intervention and outcome. Now since I've marked intervention, it is what? RCT. But if I marked if best study to evaluate exposure and outcome, what is this exposure and outcome? Cohort. Maximum evidence to establish causality. Causality में evidence based pyramid with study design is at the hierarchy. Everybody, सबसे अच्छी study design क्या है? Meta analysis. All right, were you able to answer these questions? Did you enjoy doing these one-liners? ये एक go-to slide है. Okay, this is good for your last-minute revision. This particular slide. Chalo, good. Let's move to the next question of the day. The question is, which of the following, question number 9, which of the following statement best describes DALI? Abhi, we have some more time to keep revising. We will keep doing it, everybody. All right, we have a session tomorrow. You can you can do PSM today. Questions aaj karo PSM ke, and if you have any doubt, I will be coming tomorrow at the same time, so you can definitely write it down and ask me in the comment section. Okay, which of the following best describes DALI, guys? Which of the following best describes DALI? Yes, what is DALI, everybody? DALI is a disability indicator, right? So it is number of years of life, YLL plus YLD. What is YLL, guys? Years of life lost to years of life lost to premature death. Years of life lost to premature death. And what is YLD? Years lived with disability. Years lived with disability or loss to disability. That is DALI. Suppose this is a man, okay? Now he was leading a very good life, okay? Everything is good for him. Unfortunately, listen to this, okay? At 40 years, isko cancer ho jata hai. Now when he suffers from cancer, his quality of life is going to deteriorate. Let's say he dies, unfortunately, dies at 50 years, okay? But the country where he was living, wahan pe the average life expectancy, was 70 years. That means the country where he was living, on an average, if a newborn is born today, on an average, he would go on to live till 70 years. So now what is the DALI? DALI is nothing but year of life lost to premature death. So he died at 50, right? He should have died at 70 according to that country. So how many years of life lost to premature death? 20 years. Now he suffered from cancer at 40 years and he died at 50 years. So how many years has he lived with disability, everybody? He has lived with disability for 10 years. So what is the DALI in this case? The DALI in this case is 30 years. Did you understand the question? It is only a way to make you understand, okay? So what is DALI? It measures years lost to disability and death. Okay, what is this one? Anybody? Number of years added to life due to a medical intervention. Can you put in the comment section? Option D क्या denote करता है? What does option D denote? Suppose if this was a question. Very good, guys. Number of years that got added to life due to a medical intervention is QALY. Now suppose this person at the age of 40 years, when he suffered from cancer, he took some intervention based on cost utility. All right, maybe. So when he took that intervention, his life was again good, but now he didn't die at 50, but unfortunately he passes away at 60 years. So how many years got added to his life? If he didn't take the intervention, he was dying at 50 years. Now because he took the intervention, he reportedly dies at which year? 60 years. So how many years got added to his life? 10 years. So what is QALY in that case? QALY यहाँ पे कितना हो जाएगा? QALY is 10 years. Clear? So you should know this. Plus, I have also given a slide which is very good for you to revise. This is your revised slide basically. इसको बोलते हैं go to slides. Go to slides mean at the end you have to refer to this. Everything about DALI is here. It considers mortality, morbidity, disability. One DALI is 1 healthy year of life loss. This is best measure of disease burden. Best measure of disease burden. All right, that's the best measure of disease burden. The simplest measure of disease burden is proportional mortality. This is the best. QALY, number of years that get added to life because of an intervention. We've already done. HAIL के साथ the buzzword is number of years a newborn is expected to live in full health. And what is Sullivan's index? Anybody remembers? What is Sullivan's index, guys? It is nothing but life expectancy minus duration of disability. Disability free life expectancy. Okay? Chalo. So let's go to the next question, everybody. Let's see this one. All of the following are morbidity indicators except. I told you certain health indicators could also come in the exam. So this is question number 10. All of the following are morbidity indicators. Notification rate, incidence rate, attendance rate, expectation of life or life expectancy. Good. Life expectancy, guys. This is nothing but a positive mortality indicator. Okay, what is this? Positive mortality indicator. Expectation of life is a mortality indicator. How many years a newborn is expected to live based on current mortality rate. So this is what? This is a positive mortality indicators. Again, you shall find all these are morbidity indicators. Again, for your revision, I have kept a go-to slide. The different morbidity indicators, most commonly those that are used are like incidence, prevalence, notification rate, OPD rate, sickness absenteeism. Healthcare delivery indicators कभी-कभी पूछ लेते हैं, doctor population ratio, population bed ratio, all of that. Okay. Healthcare utilization indicator, bed occupancy rate, bed turnover ratios, health policy indicators. Okay. India has said, this is a PYQ, that it will spend 2.5% of GDP by 2025. I hope you remember this. Ye PYQ. And of course, we did the disability indicators. Clear? Shall we move on to the next slide? I hope you're enjoying the session, guys. We're done with 10 questions. Let's see the remaining 40. What is your answer here? Which of the following statement is incorrect about Ayushman Bharat National Health Protection Scheme? Chalo, good. Keep answering. Which of the following is incorrect about Ayushman Bharat? Which of the following is incorrect? Upgrade sub-centers in PHCs to health and wellness centers. Now, what is the new name for it, guys? Ayushman Arogya Mandir. Ayushman Arogya Mandir. Why is it that we've been, we've given these nomenclatures? Because, guys, pehle kya hota tha na, initially we didn't offer entire services. Right now, in these sub-centers and PHCs, we have broadened the services. All right, services have been broadened. Services broadened. Services broadened means that now we have also included the modality of NCDs. We have also providing services for Ayush. Health insurance coverage up to 5 lakh per family per year. Absolutely correct. Number of family members and age, no restriction. Age appropriate health promotion at school is being done. Yes, IFA tablets is also being provided under Ayushman Bharat. Ye incorrect tha. Treatment of all pre-existing diseases are not covered. No, it is covered, guys. Like suppose somebody avails Ayushman Bharat services today, then if he has a problem from before, that will also be included. But more important than this, I have given you out a couple of slides which you can do for your revision. This is the logo for Pradhan Mantri Jan Arogya Yojana or Ayushman Bharat, and it is an initiative to achieve universal health coverage. ठीक है, ये क्या है? Universal health coverage, which is quality care, financial protection. All right, we are offering financial protection to the people. So what I have done, guys, I have put out all the points for Ayushman Bharat in these couple of slides that you should remember. Health insurance 5 lakh per family per year. No, Nasarta, it's not uniform. It's not uniform. Right now we are sticking to 5 lakh. Okay. In certain states, yes, but right now we're sticking to 5 lakh. Any update, I will let you know. All right, it's state-wise, yes. No cap on family size and age of members. You can see we wanted to build New India by 2022 and it has subsumed. It includes 2 other schemes, guys. Rashtra Swasthya Bima Yojana, Senior Citizen Health Insurance Scheme. So all the points, we are providing wider range of services like you can see over here. And please do go through these points that are mentioned यहाँ पे. No cap on family size and age of members, age of the members. It priority given to girl child, women, senior citizens, secondary and tertiary care hospitalization, IPD care के लिए है. It also covers charges 3 days pre-hospitalization, 15 days post-hospitalization, and private beds that have at least private hospitals with 10 beds can also provide services under Ayushman Bharat. Okay, so these slides are meant for your reading. Like I said, isko zarur read kar lena. It is here. It is to achieve universal health coverage in India. It's like some points that you should not miss from Ayushman Bharat. Okay, all right, proceeding to the next question. What did you answer for this? Which of the following is not a characteristic of a common source epidemic with a single exposure? So of course you will expect the type of epidemics in the exam, guys. Batao. Common source epidemic with a single exposures. The epidemic curve shows a rapid increase and decrease. Yes, correct. Cases are spread across multiple incubation period? No, they are spread across a single incubation period. Now, because cases are spread across a single incubation period, it is what? It is explosive in nature. There's clustering of cases in one incubation period. Single tall peak, as you can see, with no secondary waves. So, I'll just show you the image also for your revision so that you can revise it later. Ye dekho, this is single exposure. This, guys, is single exposure epidemic. A very good example of this is food poisoning. Also a good example of this, everybody, this one, Bhopal gas tragedy. Okay, Bhopal gas tragedy. But when what happens, the cases spread across multiple incubation period. Like you can see, gradual rise, fall, multiple incubation period, prolonged plateau. Here, what is this? Common source, continuous exposure. So, sometimes they ask you example of this. 3 example exam के लिए याद रख के जाना. Commercial sex workers, infected milkman, all right, infected milkman and contaminated well. Contaminated well. You should remember about this. Last but not the least, look at this type of epidemic. It is kind of irregular type, short plateau, but it is occurring over multiple incubation period. Here also, this is person to person transmission. Okay? This is person to person transmission. So what is the name of this epidemic, guys? This is nothing but propagated epidemic. All right, this is nothing but propagated epidemic. Clear? And whatever I have mentioned, you will find in this go-to slide for your exams. Okay? A comparison with what I just told you. Single incubation, multiple incubation period, which is explosive, which is non-explosive. All the examples are given here. Okay? Dekho guys, RR may we always touch the short topics. These are topics that are meant to come in the exam. Okay? So we are revising that. Chalo, anybody was able to do this question? A numerical. A study was conducted over 15 years to evaluate the risk of mesothelioma among workers working in ship-based industry. The study included 200 workers exposed to asbestos and 300 workers not exposed to asbestos. Among those exposed, 40 developed mesothelioma and died in the terminal stage, while only 5 of the unexposed. Risk ratio, batao. Now guys, risk ratio, I wrote it deliberately. I'm sure each one of you knows risk ratio is nothing but relative risk, right? Risk ratio is nothing but relative risk. You calculate in a cohort study. And you don't need to draw a 2 by 2 table here. Actually, aajkal calculators you do get, but then it could be done that way also. Whenever a numerical tries to remember the formula, incidence exposed upon what everyone? Incidence exposed upon incidence non-exposed. Okay, incidence non-exposed. So if you see over here, among exposed, so how many people? 200 workers are exposed to asbestos. So 200. How many developed mesothelioma? 40. And how many are non-exposed to asbestos, guys? 300. Out of them, how many developed? 5. So this is what? So this is a little hidden. So I'll write it again. 5 upon 300. Right? So this is what? 40 by 200 into 300 by 5. So you can very well do it, guys. What was your answer, everybody? Yeah, it is 12. So now what does it mean? It is a risk factor. I hope you remember the interpretation of relative risk. It could be more than 1, it could be equal to 1, it could be less than 1. More than 1 means risk factor, equal to 1 means no association, and less than 1 means, everybody, it is nothing but a protective factor. Okay, guys? कर लोगे? What's the formula for attributable risk for FMG exams? You should know at least relative risk and attributable risk. Attributable is incidence exposed minus incidence non-exposed, everyone, divided by incidence exposed, divided by incidence exposed, and of course we have to multiply with 100. Okay? Chalo, next one. Life expectancy of two different countries can be compared using which of the following demographic indicators? Can you tell me the answer to this? Yeah, this is a question where we have to revise actually HTI and PQLI, guys. Life expectancy of two different countries, HTI. Because if you see in HTI we have life expectancy. Quali mein abhi humne padh liya, it's number of years added to life. DALI, years of life lost to premature death and years lived with disability. HPI is human poverty index, no longer used. HPI is nothing but human poverty index, guys. Human poverty index. This is no longer being used. It has been replaced by now MDPI, multi-dimensional poverty index. Okay, which includes 3 things. Poverty is like health. So इसमें हो जाएगा health, education and poverty. Health. The mnemonic for MDPI is health, education, and also you have everyone living standards. But here it was HTI. Now I wanted to actually revise. Do you all remember the difference between PQLI and HTI? Shall we do it quickly, guys? PQLI and HTI. PQLI का mnemonic क्या है? Ill. The mnemonic for PQLI is ill. I stands for infant mortality rate. L stands for life expectancy at age 1, and L stands for literacy rate. Now, if somebody is ill and you don't treat him, they will kill. They will get killed. So, HTI is kill. Now, what does K stand for, guys? Knowledge index or education index. Now, development without income doesn't make any sense. So, gross national income. And life expectancy development we should see right from birth, at birth. One more thing, knowledge index or education index में 2 चीजें आती हैं. 2 indicators, mean years of schooling. Okay, mean years of schooling, and of course you have expected years of schooling. Mean years of schooling and expected years of schooling. Both of these you have in that. PQLI 0 to 100, HTI 0 to 1. Current score HTI 0.644, rank of India 134. If anything changes by your exam, I will definitely convey it to you. Okay, rank abhi 134. और एक favorite question, guys. HDI का concept किसने दिया? Who gave the concept of HDI? Anybody in the comment section? HDI concept was given by, so it was given not by WHO. Okay, HDI का concept is UNDP, United Nations Development Program. You should know this. ठीक है? Question ये भी पूछ सकता था. They could have asked, instead of saying life expectancy of 2 different countries, they could have asked standard of living of 2 different countries can be compared by. Everybody focus here. If I asked you the question, standard of living of two different countries, what would your answer be? Standard of living of two different countries, तुम्हारा आंसर क्या होगा? If I have to compare standard of living of two different countries, guys, again your answer would have been HTI, because no, not MDPI, Hassan, not MDPI, dear. MDPI is poverty. MDPI measures acute poverty. Even if they asked you your standard of living. Okay, chalo, let's continue. Global Hunger Index does not include which of the following component? Okay, IMR, U5MR, child mortality rate, percentage of undernourished children under 5 years. So what is it? Very good, guys. IMR. Now I hope you've seen the RR videos also. There I've told you a story kind of thing to remember it. If you see Global Hunger Index, I'll straight away take you to the explanation. Imagine a child who's very weak and looks very weak, and there are children who are found in the streets begging. So if you look at that child, you see that he gets inadequate food supply. Inadequate food supply means he's a very weak, thin child. Okay, very weak, thin child. So inadequate food supply means what? Proportion of population was undernourishment. Because of inadequate food supply, undernutrition, which is wasting and stunting. And any child who's on the street is not necessarily a 1-year-old or a 2-year-old. He could be up to 5 years old also. So child mortality, nothing but under 5 mortality rate. Clear? So this I wanted to revise. PQLI ho gaya, HTI ho gaya, guys. DALI, QALY, HALE, Sullivan's Index are done. Global Hunger Index are done. These are the things which are PYTs. Keep coming. All right. Another one, patent MCQ. What is the answer to this? Water from a stagnant drain is collected in a container and observed for breeding mosquitoes. The image of the larva, everybody, is shown below. What is the answer to this? Very good. Very good. Guys, isko dekho. Look at this. This is a siphon tube. Siphon tube is a breathing tube. And when we have a longer siphon tube, okay, when we have a longer siphon tube, everybody, it is nothing but Culex, a longer siphon tube. This is a longer siphon tube. Let me show you the other image. Look over here. Can you see this? Everybody. One more thing in this statement was this stagnant drain. All right, stagnant drain. Ganda pani mein it's Culex. Okay. Over here, look at these image. Look at these image. This is one of the other expected ones where the larva rests parallel to the water surface. So when the larva rests parallel to the water surface, it is Anopheles. And when we have siphon tube, it could be Culex or it could be Aedes. Now, if it is a longer siphon tube, all right, longer ST, it is nothing but Culex. If it is a shorter siphon tube, it is nothing but Aedes. Okay? Okay? All right. Another thing that you should remember from this is we will also be looking at the other images in entomology. Maybe tomorrow's session there will be a questions. I will add it here. Abhi ke liye we are done with the larva. But you will go through these slides also, guys. These are your go-to slides where I have compared the different types of mosquitoes. Clean stagnant water overhead tanks. If you see artificially collected water, Culex, dirty polluted water, Mansonia, water bodies under aquatic plants, you should know that. Then eggs and the shape of the adult, I will show you by pictures once. This is the larva. Okay. All right. So this you should remember. Yeah, that's also good way. Culex longer and Aedes has a shorter siphon tube. Okay. So you can go through these charts. Chalo. Let's go to another numerical for the day. A region has a population of 6,000 people below 15 years. If time permits, I will show you the other images for mosquitoes, okay? Let's see, we have time tomorrow also, right? All right, a region has a population of 6,000 people below 15 years, 12,000 between ages of 15 and 65, and 2,000 over 65. Calculate dependency ratio. Currently in FMG exams, they're asking about a lot about dependency ratio. What is dependency ratio, guys? Children who are below 15 years plus elderly who are above 65 years are dependent on the working class 15 to 64 years. So here we see this is 66,000. Here we see this is this is 2,000 and here we see 12,000. So very well we can make out 8,000 by 12,000. So what was your answer, everybody? So I'm sure you were able to do it. Below 15 and above 65, 8. So this was your answer and here it was given. You will get it as 0.66. Okay. Dependency ratio is something that you should know for your exams. All right. Let's go to the next one. Okay, so I'll write it over here. Which of the following is live vaccine? Ekta tetanus was the option. The second one is Sabine vaccine. Now we'll see some EPID questions, vaccine question, HPV vaccine and hepatitis B vaccine. Oh, the fifth one disappeared. I can't see only. All right, what was the fifth option, guys? Any which ways, I will do it here itself for you. Anybody remembers? 215, but what was the fifth one? Somewhere, Rota. Okay, thank you, Rota. All right, now if you see tetanus vaccine is a toxoid. So of course, isko chhod do. Okay, toxoid means a type of subunit vaccine. Okay. Sabin, Salk and Sabin. Sabin is nothing but OPV, which is a live vaccine. HPV, an upcoming question. HPV is a subunit vaccine, human papilloma virus vaccine. जिसमें HPV like we have is now going to be a recombinant technology, recombinant DNA. Hepatitis B, again recombinant DNA. Yes, I love chick embryo, very good, recombinant DNA. Rotavirus is live. So your answer was 2 and 5. चलो अच्छी बात है. देखो guys, these topics don't go all the types of live and the kill vaccine. Okay, before I move ahead, rabies vaccine बताओ is which type of vaccine? Rabies vaccine. Anybody? I hope you remember the mnemonics. For live vaccine it was I love chick embryo. For killed vaccines it was killed. Rabies vaccine is live or killed? What is your answer? I want the answer. Very good, guys. Killed, K-I-L-L-E-D. D was the mnemonic. D for dog, yani rabies. That means you will definitely give it to a pregnant female also. Okay, moving to the other one. Open vial policy is not applicable to which of the following vaccines? Open vial policy is not applicable to which of the following vaccines? Now, what is open vial policy? Partially used open vials can be reused up to what duration? So it can be partially used vials, can be used up to partially used vials. Okay, can be used up to how many days, guys? 28 days or 4 weeks, provided they are maintained in proper cold chain, +2 to +8. Expiry date has not passed. Vaccine vial monitor has not reached the discard point. Vaccine vial septum is not contaminated. Aseptic techniques have been used to draw the vials. This is important. So what was the vaccines that follow open vial policy? Vaccines that follow. Just wanted to revise the mnemonic. Open vial policy. What was the mnemonic, everybody? All T series vaccine. All T series vaccine plus PIOPO plus J killed. Please remember J killed. Now follows open vial policy. And all T series. What is the update in T series? Rotavirus. Old videos you will see rotavirus does not follow. But abhi rotavac follows. DPT. All T series. T series means have letter T in it. Penta. Hepatitis. Alright. Penta. Hepatitis. All of them follow. TT, TD, all of these vaccines follow open vial policy. PCV, okay, PCV, IPV, OPV, and of course we have one more, Japanese encephalitis killed. Those that do not follow, guys, do not follow are the reconstituted vaccines. What are they? Reconstituted. Now, once you talk about the reconstituted vaccine, BCG, the diluent for BCG, I'm revising here itself, normal saline. Okay, measles, sterile water. J life, phosphate buffer. It's not killed J. Killed J to follow karta hai. This is what? J life. And of course, yellow fever. They do not follow the open vial policy. But even if they follow, guys, you have to check for the expiry date. If expiry date has gone, then you're not going to use it. Okay. All right. Next one. True about VVM. What is VVM? What is VVM, everybody? I hope you remember. Vaccine. This is a patent MCQ. Came in last NEET PG also. We will be expecting this in our exams. True about VVM. Vaccine vial monitor. So, monitors heat exposure, yes. Indicates cumulative heat exposure, yes. Damage of vaccine vial to overexposure to heat. Determines vaccine efficacy, no, not directly. Guys, VVM never measures vaccine efficacy directly. It reflects heat, which is an indirect measure of vaccine efficacy. Can be used for expiry calculation, never. Expiry date can be changed, no. Discard if square is lighter than the circle, no. You won't discard if the square is lighter. If square is lighter than the circle, you will use it. So over here, what are the correct answers? 1 and 2. So look at this image. Can you all look at this image, guys? This is the image of VVM. Last time in NEET PG, again they asked which are the images you will use. So always remember, Dunya goal hai. What do you mean by Dunya goal hai? The world is round. So we have the outer circle and inner square. Also remember, chemical is inside the square, and we will always compare square with the outer circle. If inner square is lighter than the outer circle, we will use. If like light white, blue. If inner square starts to change color but is still lighter than the outer circle, we will use. Like inner square light blue, outer circle dark blue. Inner square and outer circle same color, we will discard. Blue and blue. Inner square dark blue, outer circle light blue, discard. And where is it that you're going to discard? In which color bag? Another MCQ. कौन से color bag में discard करोगे, guys, if the vaccine vials has been damaged? Yellow bags, okay, because right now they contain vaccine in it. Otherwise, technically speaking, if you got the question, I think I also gave you a question on that. Vaccine vial, yeah, broken vaccine vial, all of that go into blue bags. Okay? Otherwise, when they have vaccine, it is yellow bag. I think we have a question also on that. We will see that. Okay. All are correct about ILR except ice line refrigerator. All are correct about ILR except option A. Keep all vaccines, including those returned under open vial policy, in the basket supplied with ILR. Store diluents at +2 to +8 at least 72 hours before dose. Keep freeze-sensitive vaccines at the top of the basket. Arrange vaccines as per their expiry date. Early expiry ones above, later expiry ones below. Guys, I have not got a single correct answer here. Except pucha hai. Except pucha hai. Now, if you look at, do go and revise vaccines from RR if you get the time. I have also showed you the image of ILR, guys. All right, ILR we never keep the vaccines directly. We have baskets in which you have to place the vaccine. So keep all vaccines, including those returned under open vial policy, in the basket supplied. True. Keep freeze sensitive vaccines at the top of the basket. Again, that is true. Now, if you look at the ILR, look at this image first. Look at these image first, okay? Now, it is opened from top, opened from top. So, once you open it from the top, guys, what happens? Cold air goes and settles at, cold air settles at bottom, settles at bottom. So, at the bottom, if there is cold air, will you have heat sensitive or freeze sensitive vaccine? Of course, you're going to have heat sensitive vaccines at the lower end. You will have heat sensitive vaccines at the lower end, right? Cold air goes and settles at the bottom. Now, what are the heat sensitive vaccines? R-bomb, reconstituted BCG, OPV, measles. Now, most heat sensitive is reconstituted BCG, but we can't use it again. So what is the next in line? OPV. So at the bottommost you have OPV, then you have measles. Then BCG, the normal BCG, not the reconstituted one, the powdered one. And if you look at the top, guys, at the top, what do you have? At the top, you will have the freeze sensitive vaccines. क्या होगा? Freeze sensitive vaccine. Most freeze sensitive is hepatitis B. And एकदम बीच में, in the middle of an ILR, heart of an ILR, you have TT and TT vaccine. So when I say this statement, when I say that All vaccines, including those returned in the basket, yes. Keep freeze-sensitive vaccines at the top, of course. And arrange vaccines as per expiry date. The ones that you're going to expire first should be before, so that I pick them earlier. Clear? This is incorrect. You can store diluents at sea. What I mean by this statement is diluent. Can you keep diluent at room temperature? Diluent can be kept at room temperature, can be kept at room temperature. That's okay. But 24 hours prior to session, 24 hours prior to session, diluent should be brought at the same temperature. Okay, diluent brought at same temperature. You have to store the diluent at same temperature as the vaccine. Place it in an ILR, domestic fridge, wherever, but they have to be brought. So this was the incorrect. यहाँ पे 72 hours था ना, this should have been 24 hours. Clear? Everybody give me a thumbs up. Got it? Okay, can I move to the next question? Most of you were not able to mark this. Sahi ho gaya abhi? Give me a thumbs up. Going to the next one. Okay. A 7-month-old infant is brought for routine immunization. He has received BCG and hepatitis B at birth, followed by OPV3, Penta3, IPV2, and Rota3 at 14 weeks. The parents are unsure about the next scheduled vaccine, which should be administered next. So it was a very decent question on routine immunization, guys. You didn't have to worry a lot about this question. Think and mark. 7-month-old has brought to the routine immunization. Now 7th month mein to routine hota nahi. He has received all due vaccines till 14 weeks. He is completely vaccinated till 14 weeks. Now after 14 weeks, when should he come? Should he come at 7 months? No, he's going to come at 9 months. And when he comes at 9 months, guys, if you remember, measles, rubella ka first dose, J ka second dose. Now when I say measles, rubella first dose, you can remember R se rubella or R se right upper arm. They are both given subcutaneously. So right upper arm, and J is given on the J, this is live, given on the left upper arm. And at the same time, we also give vitamin A. So what is the correct answer over here? Measles rubella vaccine at right upper arm subcutaneously, and the first dose of vitamin A at 9 months. Clear, everyone? Everyone, यहाँ पे इंट्रामस्कुलर तो देते नहीं है, you give it subcutaneously. DPT booster is not given at 9 months. DPT first booster is given at 16 to 24 months, and DPT का second booster is given at 5 to 6 years. OPV booster is given at 16 to 24 months. So it was just a question which was based on your NIS. ठीक है? चलो, next question. Anybody? Okay, what did you mark with this? A 9-month-old baby was brought for routine immunization. However, the mother of the baby informed the doctor that the child is on tap prednisolone for last 6 weeks. All of the following vaccines can be administered to the baby except. Again, I just want to ask you the same question. What are the live vaccines? What are the killed vaccines? Because if you talk about the live vaccines are the ones that are contraindicated in immunosuppressed conditions. Now, if somebody is on tab prednisolone, it is hinting that the child is immunosuppressed. So what are we not going to give? Do not give live vaccines. Okay, do not give live vaccine. So which is the live vaccine over here? Do not give live vaccine. Of course, pentavalent is not the live vaccine, guys. It's a combination. IPV is killed, pneumococcal again subunit, measles, rubella. I love chick embryo. So same thing. You should remember, any child who's immunosuppressed, any child who's on steroid, any child who, who is, suppose, recurrent yeast infection. Again, the underlying immunosuppressed condition. So which vaccines are contraindicated? Live vaccines. Okay? Okay, yeah, except और ये सब words आपको बहुत ध्यान रखना है, ठीक है? चलो, next one. This came in the last NEET PG exam also, guys. A similar question to this, so I thought I will revise this once again with all of you. 32-year-old person traveled to Africa. He reported fever followed with chills. Which vaccine, if he had taken before travel, could not have developed this disease? So of course we are talking about yellow fever. Now yellow fever vaccine, yellow fever as a disease does not occur in India. right? It can. What is the vector of yellow fever, guys? The vector for yellow fever is Aedes, and Aedes is present throughout India. The climate condition of Aedes is amazing. It is present throughout India. So the certificate has to be taken. One question: validity of vaccination certificate lasts, anybody? Validity of vaccination certificate. Once the person has taken, the validity starts from 7 to 10 days, but it lasts, validity of vaccination certificate lasts lifelong. Okay, this you should remember. Quarantine period: if somebody does not have the valid certificate, vaccination certificate, the quarantine period has to be 6 days. Okay, quarantine period has to be 6 days. And of course, this is the live vaccine. You should know a couple of questions regarding yellow fever. It is a live vaccine. All right, going to the next question. Which of the following is not included in the IT initiatives under Mission Indradhanush? What do you have to answer here? Which is not included in the IT initiatives? Okay. IT initiatives Mission Indradhanush, Anmol to hai guys. ANM online. This is definitely, it is meant for tracking. ANM online is there. AEFI is not a word that we use. Okay, that is given by WHO. In Mission Indradhanush, we are using SafeVac. Alright, AEFI is adverse event following immunization. Adverse event following immunization. Following immunization. Okay, and if you talk about Anmol, it is ANM online. It is a mobile based tablet which is given to the ANM for tracking pregnancies. Okay, mobile based tablet. It's a tablet which is given for tracking pregnant females and children. All right, track pregnant females and children for immunization. What is electronic tablet based software? Yes, electronic vaccine intelligence network. Wherever the stock of vaccine is not, like, suppose I run a vaccination clinic, I don't have rabies vaccine right now, so I can check on the even app where the stocks of vaccine is available. Electronic vaccine intelligence network. This is for stock of vaccine. And SafeVac is surveillance and action following vaccination. Surveillance and action following. So you can see over here, like we have certain this thing. This is ANM online. This is surveillance and action for event following vaccination. This is even, and this is human. Human is 0 to 5 year old ke liye all immunization details are on the human app, like 0 to 5 years. What are the vaccines given? What is still left? Everything, every detail is given on the human app. जैसे कोविन था ना, but human is online immunization card, like a thing for which year? 0 to 5 years. ठीक है? So you should know these IT based initiatives. All right, going to one more numerical for the day. Let's see if you can answer this one, guys. Calculate the maternal mortality ratio for the year 2024 given the following data. Now, why did I say, when I say ratio, what does ratio mean? Is numerator a part of denominator? No, numerator is not a part of denominator. So what is this? This is nothing but total number of maternal deaths. Total number of maternal deaths in a year, in a community, that's okay. But the only formula where the multiplier is not 1000, not 10,000, not 100, it is 1 lakh. Tomorrow I will sum up the formulas for you. Tomorrow, once we have a session tomorrow also same time. So at the end of this session, I will sum up the formulas for you. Abhi, let's do all the questions, then at the end I will sum up. So total number of maternal deaths per 1 lakh. Now since it's a ratio, it is live births. Now immediately don't see the woman who died is 6. No, you have to count, because maternal death includes women who died during pregnancy, who died during childbirth, or up to 6 weeks post-delivery. It excludes accidental, incidental. Exclude which causes? Exclude accidental / incidental causes. You will not add those. So RTA, you will not add. Snake bite, you will not add. So how many deaths are happening? Sepsis, obstructed labor, eclampsia, ectopic pregnancy. 4. And what was the live birth, everybody? 4,000 per 1 lakh. Okay, per 1 lakh. So this becomes 100 per 1 lakh live births. They could also write it as, they could do one thing. They could change this and write 1 per 1,000. That's also okay. They could write 1 per 1,000 live birth. Ye bhi chalega. But since in the answer you had 100, that becomes your answer. Clear? Now, what is the common mistake that we could do over here? We will see maternal death, total woman who died 6, and we can straight away put it in the numerator. Please don't do that. Okay, that is something that has to be avoided. Exclude incidental causes. All right, question number 27. Glucose tolerance test is a useful screening test for diabetes. The ability of the test to differentiate diseased from non-diseased is called as. What is your answer here? Diseased from non-diseased. Are you writing? Okay. I want some more answers here before I tell you the answer. So I'm getting all the answers here. Guys, this is one definition which includes asking diseased, non-diseased. So diseased means true positives, non-diseased means true negative. Now I want a definition where true positive and true negative are apart. True positive means what? Means nothing but sensitivity. True negative means what? Nothing but specificity. And what is the definition that includes both sensitivity and specificity, everybody? It is nothing but validity. This is nothing but validity or accuracy. I deliberately gave you this one, everybody, because over here what happens, I deliberately gave you this because many times we immediately mark answers sensitivity or specificity. No, validity is a property, guys. Yaad rakhna, property of a screening test. I'll tell you that tomorrow. Okay, Adil, don't worry. Tomorrow we have diseases, initiatives, programs. We'll talk about that. Property of screening test is ARV. Acceptability, one is acceptability, one is reliability, and one is validity. Validity includes sensitivity and specificity. Are you understanding? So validity is to differentiate people who are developing the disease from those who are not developing. Sensitivity means ability to identify all those who have the disease, true positives. Specificity means all those who do not have the disease, true negatives. What is reliability? Same findings again and again. So the buzzwords with reliability is like reproducibility, consistency, precision. Okay, give me a thumbs up. Did you understand this? Don't make this mistake, guys. Sometimes you do end up making a mistake here. All right, another MCQ. A test has 90% sensitivity and 80% specificity and is applied on two communities, A and B, with disease prevalence of 50% and 30% respectively. Identify the correct statement. The answer there. Guys, one simple equation application which has been asked n number of times in the exams. A simple application of an equation. PPV is directly proportional to prevalence. NPV is indirectly proportional to prevalence. How? Why? We are not getting into that. Sensitivity and specificity of a test. Sensitivity and specificity of test. Sensitivity and specificity of test, everybody, is independent of prevalence. Prevalence says sensitive. If a test has a sensitivity of 90%, it's going to remain the same whether prevalence of the disease in the community is 10% or 50%. Are you understanding? But here there is a logical, whenever you get a question of predictive of prevalence and this thing, the answer is directly PPV, directly proportional to prevalence, NPV indirectly. So here you can see 90%, and that we don't have to worry. All right, two communities have prevalence, A में 50% है and B में 30% है. So PPV is more in A than in B. Of course, PPV is more in A than in B. NPV is more in B. All right, NPV is more in population B than in A. So that's also a correct way of saying it. NPV is less in population A than in B. Yes, all of the. So over here, what you can do, see. Here it was 50% community A and 30% community B. So PPV is more in A, PPV A more than PPV B. All right. Or you could say NPV more in population B than NPV in A. Or you could say NPV is less in population A than in B. So that's different ways of interpreting. So what does your answer become over here? All of the. But what you should remember, guys, sensitivity and specificity of a test are independent of prevalence. Am I clear? Did you get this equation, everybody? Bas itna yaad rakhna. PPV is directly proportional to prevalence. NPV is indirectly proportional to prevalence. Whenever you get a question of prevalence, it's going to affect PPVs and NPVs. Sensitivity and specificity of the test are not at all affected by prevalence. Okay, what about this question? Question number 29. What is the answer to this? A screening test was carried out among 114 people, out of which 15 have a disease. The test showed 22 people tested positive for the disease, among which 14 actually had the disease. See guys, before you make the 2 by 2 table, of course it's you have to figure out what is A, what is B, what is C, what is D. Now I've always told you the outcome has to be on the column side. Disease, yes, no. Screening test result on the row side, positive, negative. A, B, C, D. TP, FP, FN, TN. First row all positive, second row all negative. अब यहाँ पे बोल रहा है 114. Before I draw the 2 by 2 table, I'm just trying to see what are the things given to me. A plus B plus C plus D is 114. Out of which 15 have a disease. Now 15 have disease. So can you tell me 15 is A plus B or is it A plus C? Anybody? 15 क्या है? A plus B है या 15 A plus C है? Disease? Yes. So what is 15, everybody? A plus C is 15. I will show and draw the thing also for you. Test showed 22 people tested positive. So what is 22? A plus B or A plus C? Test positive. What is 22? A plus B is 22. Out of which 14 actually had the disease. A is 14. Just try to figure out. See, I'll draw it for you now. Disease, yes, no. Okay, over here you have screening test result. What is that? Positive, negative. A, B, C and D. Okay, this is TP, this is FP. In the first row, all positives. In the second row, all negatives. Now, 15 have a disease. So, this is your 15. 22 tested positive. This is your 22. 14 had the disease. So, what is sensitivity, everybody? What is sensitivity? Sensitivity is nothing but TP upon TP plus FN. Ability to detect all those who have the disease in 200. So how many people have the disease? Gold standard would have said 15. Screening test has identified it in 14. So 14 by 15 into 100. So that is roughly 93%. Okay? See, never be in a rush. You will have to figure out the options that are given to you. Okay, what is A, what is B, what is C? What is specificity, guys? Ability of a screening test to identify all those who do not have the disease. So, disease, no. How many people don't have the disease? TN plus FP. Screening test identified it in TN. What is PPV? All positives. Out of all those tested positive by a screening test. So how many have been tested positive? TP plus FP. How many really have the disease? TP. They go all positives. Of course, you will multiply with 100. And what is NPV? Out of all those tested negative by a screening test. So how many have been tested negative? TN plus FN. How many really do not have the disease? TN into 100. Okay, so do revise the formulas. Never be in a rush, guys. See, there will be one question which will take maybe 30 seconds, 10 seconds. है ना? So, you can definitely devote 1 minute, 1.5 minutes for one of the numericals. Are you understanding? It's not that every question is going to take you 1 minute or 1.5 minutes. So, never panic. Whenever you get a numerical, try to recollect the formula and accordingly mark. Thumbs up, everybody. Give me a thumbs up. We have 20 more questions to go. What is the answer to this one? Batao. Changes in birth rate and death rate of two countries X and Y have been shown. Okay, was studied by a group of epidemiologists. The data is collected is shown below. Okay, the data has been given below, guys. हाँ, ठीक है. Now, instead of asking you directly, I am going to ask you demographic transition model. Okay, demographic transition model. Now, if you remember, what is stage one? Just look at me, guys. What is stage one? If suppose this is the pen and this thing, birth rate high, death rate high. What happens to the population? Stable. So, what is this known as? High stationary. What happens in the second stage? Life expectancy increases, hospitals come up, so death starts to decline. But birth rate is still high. If in the first stage it was 40, in the second stage it is still 40. So death starts to decline, birth rate is still high. Okay, this demographic gap, CBR minus CDR, goes on increasing. This is known as early expanding, population growing at a faster rate. What is the worst phase of all? Population explosion, demographic trap. What happens in the third stage? Death rate declines even further. Family planning for the first time comes into play. Birth starts to decline for the first time. So which stage births decline for the first time? Stage 3. What is this stage known as? Late expanding. Population is growing but at a slow rate. Stage 4, death low, birth rate low. What is this? Low stationary. Finally, CBR below CDR. So now, if you look at the question, country X birth rate in 2011 was 45.6. 2021 is also 45.6. That means what has happened? Birth rate has remained the same in 2021, but death rate is showing a decline. So what is the stage where birth rate is the same, but death rate shows the decline? It is nothing but stage 2. Now look at country Y. Birth rate was 13.3, okay, in 2001, 11, and death is also 13.2. But it's not high, it's low. The values are low, low stationary. Look at deaths, low and low. So what is this stage, everybody? This is stage 4. So correct answer is stage 2 and stage 4. Instead of like asking you directly, I've just given you values and answers. Did you all understand this? If I ask you which stage has the highest birth rate, what will you answer? Highest birth rate कौन से stage में, guys? Where do you see highest birth rate? Anybody? Highest birth rate. Highest birth rate कब होता है? Highest birth rate is stage 1. Birth rate remains same. Please remember, birth rate remains the same in stage 2. Death rate starts to decline, stage 2. Birth rate starts to decline, stage 3. Birth rate starts to decline is what? Is nothing but stage 3. Okay? Chalo, next question. Some fertility indicators we should definitely do before we go to the exam. General fertility rate is, what is your answer? Do one thing, you tell me each of these. Okay, number of live births in a woman in reproductive age 15 to 44 years. All right, very good. This is only the answer. Good. Number of children. Buzzword yahan kya hai, guys? Children. Now, if you see children, so number of children a woman will have if she were to pass through her reproductive years. Children is the buzzword. So your answer is what for children? TFR. Buzzword agar children hai, it is TFR. So look over here. You can just revise from total fertility rate. Yeah, children a woman will have is TFR. If you look at this, I asked you, सबसे पहले देखो, crude birth rate. Live births per 1,000 mid-year population. But everybody in the mid-year population is not exposed to giving birth, so we made it women in reproductive age group. But again, every woman is not equally exposed, so we made it married woman in reproductive age group. This is general marital. You have to read it in the same order. Similarly, I have put out certain things for you. Total fertility rate. This is what? Children is the buzzword. 15 to 49 years old, how many children a woman will have? Out of those children, how many will be girls? Gross reproduction rate. Out of those girls, how many are going to remain alive? Mortality rates consider karte hue. This is what? Net reproduction. ठीक है. Also we know when will a country's population become stable? When NRR is equal to 1. That means when TFR is 2.1. 2.1 का मतलब क्या होता है guys? 2 child norm. This is the desirable TFR. This is the desirable TFR. That means on an average 2 बच्चे, 2 children. So girls, law of probability 50% girls, so NRR 1. But this is possible only when 60%, more than 60% of couples use a contraceptive method. हमेशा याद रखना, always remember desirable or ideal TFR guys is 2.1. India although right now has a TFR of 2, but that is not desirable. Desirable, the answer is 2.1. Give me a thumbs up for these three these fertility indicators, guys. These are again your go-to slides for the exam that you should go through the same definition: CBR, GFR, GMFR, TFR, GRR, NRR. Okay? So thank you so much. Go through all these once again. Any doubt you have from these topics, ask me tomorrow. Bye-bye. Have a good day.